Now to your health. This Pediatric Cancer Awareness Month will introduce you to a family from Ukraine. They moved here just before the war in their home country.
Yeah, and once their daughter was diagnosed, they felt like they were kind of in the right place. Health reporter Haley Hernandez explains how their treatment at Texas Children's, how it's going right now. Haley?
Yeah, the Texas Children's Cancer and Hematology Center has patients from all 50 states and from 56 countries. And this little girl I met is from Ukraine. Her family moved here for a job just before the war began. And then 2 months ago, the children's hospital where she would have been treated in Kyiv was bombed. So the family feels they are here at the right time.
Head, shoulders, knees and toes, knees and toes.
5-year-old Yesenia is used to having her tiny little body parts under examination when she comes here.
You know, they give me a poke in the finger.
When they give you the poke in the finger, does it hurt?
No, I've been brave.
She has acute lymphoid leukemia, which is the most common type of cancer in kids and also the easiest to treat.
First 6 to 7 months are pretty intensive. And then they get into the last about 2 years of therapy where they mostly are taking pills every day. Overall childhood cancer cure rates right now are 80%. In patients with leukemia, like Yesenia has, 95% and higher. And when we say cure, we mean cancer never comes back. They grow up and rule the world, which I think is what she's going to do. And it's just phenomenal.
And how the family got here is also phenomenal. Her mother and father somewhat unexpectedly chose to move to Houston just before the war in Ukraine started.
Yesenia went to pre-K and like a lot of kids, and they're all exchange viruses. But then a couple of weeks she thought that Yesenia is pale, and they told us that we need to go straight to ER.
Since the moment she came to the pediatrician office till Dr. Dreyer came to us with final diagnosis was 23 hours. And that was our first night in ICU. And when we woke up,
we opened the curtains. And I saw like Ukrainian flag.
One single pole.
Right in front of me.
Ukrainian flag.
So seeing Ukrainian flag, and I just turned to Vadim and I asked him, do you see the exact same what I see? Do you see Ukrainian flag? It was like really some kind of miracle for us. I don't know, maybe like good sign.
And maybe it was a good sign on their terrible night in the ICU, because now Dr. Dreyer is confident Yesenia will have a long, healthy life.
I think from the moment I met her in the intensive care unit, it was like, oh, this is my kind of girl. She's so bright and she's so entertaining to talk to.
I asked millions of questions like.
So we're so worried. But when she talked to us, so we understood that everything is under control.
You know, she comes from a really tough background, I think, before they came here, and she talks to me about what things are going on in the Ukraine. And that's a lot to be on the shoulders of a young girl, but she's just quite insightful and quite inspirational.
And Yesenia, who they describe as being born the boss of the family, is excited about her future in a fashion show and maybe to help others one day.
But you know, Haley, I even want to be a doctor or a nurse.
And why would you want to do that?
So they can feel better and they can go anywhere they like.
The Texas Children's Cancer and Hematology Center diagnoses more than 600 new cancer patients each year. And because the survival rates are so exceptional, there is a long-term survivor program there. And there they monitor long-term effects on the heart, liver, kidneys. Yesenia will be able to join that program in just about 4 years.
Interesting.
Yeah, so she's on her way.
I find it so sweet for the parents. I mean, it's very difficult to imagine being in that position, but it feels like from the interview, the confidence that they're getting from the staff is so important to them being strong as parents through this process.
It's funny you say that, because I felt there was a psychology behind this, right? I mean, the doctor told them, you do your job as a parent to help her feel better, I'll do my job as a doctor. And then together, I mean, you can see they've got a bright, confident little girl who's going to do just fine. But of course, the parents told me, you know, they wish they didn't have to be in this situation. But just ironic, that they came here from Ukraine. The war in Ukraine began. The hospital that she would have been treated at was bombed. So in a way, she is at the right place at the right time.
Yeah. Oh, such great news. All right, Haley, thank you.
Thanks, guys.